Now, I have been talking a lot lately about dental health, and I've been talking to a lot of dental health practitioners. And that's because this is an area of medicine that was for so long considered other. Like the area of dentistry was somehow separate from health, from whole body health, from holistic health. And it is now like being screamed from the rooftops that, in fact, these are very much one and the same, that it is one system, we are one system. And what is happening in the mouth and what happens to the mouth really impacts the rest of the body. And the rest of the body is, in general, in many cases, reflecting what is going on in the mouth. So I have another amazing and beautiful expert with me today. So Dr. Leedia Riman is with me today, and she is a holistic dentist, a biologic dentist. I'm not sure what sign you want to wear today, but she's going to talk to us about something that, despite the fact that I've had some really amazing holistic dental experts or biologic dental experts, we have not talked about its relationship to hormonal health. So, Dr. Ryman, welcome. I'm so happy to have you here.
Thank you so much. It's an honor to be here. Thank you.
So, you will take this with all the respect that I mean it with. You are very young. Dentistry has not changed that much. Most dentists are very conventional, and they're doing the fluoride drill and fill dance, right? And if they're not doing the fluoride drill and fill dance, they're sending you to the endodontist who is doing the drill and fill dance with your nerve roots. So please share with us, how did you step outside of the box?
Such a great question. So right after I graduated dental school, I did my residency at the VA in San Antonio. So
Okay.
I worked with our vets.
That was fun.
So much fun. So I saw mostly men, mostly older men. They were wonderful, hilarious, great stories, sad stories. And, you just...
And their mouths had to have been a disaster.
Yes.
Had to have.
Lots of disasters. And the stories you hear are insane. And it was a very humbling experience. It was a very, it was just a magical, I can't imagine my career without that year. It was a very pivotal year.
Okay. So you do the good girl thing and you go to Saudi Arabia and you start practicing dentistry there. What did you find?
Pure and utter destruction. And so because I spoke the language, I'm a female, American educated, so that's what they wanted. I fit the recipe. I was seeing all the women. There wasn't I think very, 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 I can count the number of healthy mouths I saw on my two hands amongst the hundreds of patients that I saw. So I'm like, oh my God, what's going on? This is very interesting. Anyways, I started going through some psychological issues. I didn't want to live in Saudi anymore. I was young and vibrant and single, and I wanted to come back to the States. And I loved Saudi. My time in Saudi, my childhood in Saudi was incredible, just to say that. I had the best childhood in the world. So I come back with one bag against my mother's will. God bless her. She didn't talk to me for a year. And I was like, I'll only come back if I'm hired by Aramco, which is I don't know if you're familiar with Aramco. It's a oil company, the biggest oil company in the world, one of the biggest oil company in the world. And the reason for that is because my program director at UCLA, he was actually working there. He's this wonderful, wonderful dentist from Utah. He was my program director at UCLA. I met up with him when we were when I was in Saudi, and I became friends with his wife and his family. And I was just like, okay, I know somebody there. And Aramco is a beautiful oasis in the desert, and it's a wonderful company to work for. But I knew they weren't going to hire me because I was too young. They need a minimum of 5 to 10 years of experience. So I told my mom, I'll come back to Saudi if Aramco hires me, knowing they're not going to hire me. That's what So I land 1 week later, Aramco reaches out to me and they're like, we want to invite you to an interview. I'm like, what? Like, I only have like a year and a half of experience. Like, what? What is this? Long story short, 6 months later, I went back to Saudi to Aramco. They offered me a wonderful offer. They treated me so well. And 2 months in, I was booked for 6 months out. Like, my schedule was packed. And I was seeing all the expats, all the Americans and the British expats, and all the women. So it was 50-50 my schedule. And then again, so like destruction, pure and utter, like lots of destruction. I was like, gosh, there's something more than to just what I learned at UCLA. God bless my education. I love it. I'm so grateful for it. But that's when my re-education started. I'm like, why are their teeth breaking down and what's happening? So there's a nutritional component for sure. There's a micronutrient component. Like, everybody was severely, even though I was living in Saudi Arabia, everybody was severely deficient in vitamin D, like severe deficiencies. Nutrition, like, and lots of pregnancies. They have a lot of children there. Like, my patients on average, each one had like 3 to 6 children, some 14 children, some 10 children. Like, I would be seeing Bedouins that lived in tents. It was a very
Yeah.
it was.
But, not for nothing, it depletes you.
It depletes you. Like, they were in depletion.
Mm-hmm.
So I'm sitting here fixing and I'm like, okay, I can fix these, but I don't want to, like, I don't want to fix this because this is so preventable. And I worked there for a couple of years, 2.5 years. And then I resigned. I don't know, like, something came to me. I needed to leave. Once again, everybody thought I was nuts because I had like the most amazing job in the world. And I was like, I need to go. And I come back. And so that's when like all the bells started ringing in my head. I still hadn't connected the dots. Okay. So I would be talking to them about nutrition and vitamin D levels, but it wasn't in the way, like, I didn't really understand why vitamin D is so important for your dental health. I didn't. I just knew it was important, but I didn't know why. So come January 2014, I send in my resignation. I am back in the States in April 18, 2014.
It's my
And
sister's birthday.
what? Really?
My sister's birthday.
Awesome.
Not 2014.
2014. And then we opened up our practice here in Beverly Hills with my brothers. So my brothers and I, all three of us are dentists. And we started like getting to work and we were seeing patients. Again, 2 months later, I meet my now husband. He starts making all these dental appointments. And then 2 years later, we're married and I'm pregnant. And I get really sick while I was pregnant and I lose a front tooth right here. I was born missing this tooth, so I have an implant here, but it got so infected, very infected. I had to remove the crown and I was walking around with no front tooth to let it heal because that turns out that it can impact your pregnancy. So oral infection can impact the pregnancy. So obviously, once I found that out, and this is me, I'm a dentist and I didn't know that back then, right? So I had to go through this, so I had hyperemesis gravidarum. I was vomiting 7 to 14 times every single day for about 8 months. And I was getting dental cleanings every 3 to 6 weeks, depending on how I was feeling. And that's how I'm able to not have any cavities right now. Like, I was my brother took really, really good care of me. And I really tried my best to do what I could at home. But after Julia was born, I went into like inward and I was like, what's happening? Like, what is this? Like, can this only be me? Like, I feel awful. I feel like my breath is different. I feel very congested. I feel depleted. And I didn't know the right words to describe it. I just feel awful. Like, I had bad breath. I'm a dentist. I didn't have a front tooth comfortable. I wasn't comfortable with my smile. I wasn't feeling good. So I go on Facebook, Mommies in LA, which is like one of the craziest, meanest mommy groups in the world. They're like nuts. But there's some, you get a lot of good info there. And I like literally put out a heartfelt message. I was like, is this only me? I just had my baby. I had a really rough pregnancy with regards to oral health. My gums are infected. Like, has anyone gone through any oral issues during their pregnancies or soon after? Within an hour, I get like, in 1 hour or like 30 minutes, I get like 150 responses. And this was in the middle of the night. Like,
Whoa.
it was, I'm like, what? So I started researching and digging into all everything that I started reading articles and research. So 65% of women during their pregnancies undergo some sort of dental issue, whether it's reversible or irreversible. So I was like, why? Why do we go through that? It's not like we don't go through enough crap. And it was
65% of
65.
women have a
Yes.
dental issue during their pregnancy?
Yes. Yes. Some are irreversible, like many of
Holy
us were,
moly.
but a lot are not. Yeah.
Wait, I have never heard that statistic before. I'm blown away right now. Do the
Yes.
gynecologists know about this?
That's why I'm going to be building bridges, baby. So I talked to my gynecologist and she was like, yeah, Lydia, like patients complain about it all the time. Like they're not feel like, so there are pregnancy, tumors. There are, and those are benign, pyogenic granulomas. There is pregnancy rhinitis that causes mouth breathing. There's so many things that have to do with pregnancy that happens when the hormones are going crazy that really impact the acidity level, the quality of your saliva, the quantity of your saliva, your ability to mouth breathe, your ability to properly clean your mouth, your fatigue, your energy. There's so much to it. Like there is so much more than, so that was like an aha moment in my life. I'm like, okay, I'm done.
I'm having the aha moment.
Okay. Yeah. So I'm like, well, I should send you the picture of me with like no front tooth so that it like makes it full circle. But then it also
We can
shifts.
put that on the
Yeah, I'm happy to offer. I'm an open book. But
on the thumbnail.
yes.
We'll draw
But
everyone in through YouTube.
and then it changes in your microbiome. It's just there's so much to it. And it's not, so there's an old myth that say for every pregnancy you lose a tooth. That's like have you heard of that? It's an old myth.
No,
Yes.
I'm dying.
Yeah.
I cannot believe this whole conversation. I did not expect this. I did not see it coming. I'm like, woo, blown
Yeah.
away.
Yeah.
Okay. For every pregnancy, you lose a tooth. I don't
False.
even know what to do with this
That's
information.
like false. You don't lose a tooth, but that stems from a little bit of truth in that you are extremely compromised when you're pregnant. You need to take extra care of yourself on so many levels and facets. And not only does it start during pregnancy, it's before pregnancy. So for those trying to conceive, and we live in a world where IVF is so prevalent. All my friends have like frozen their eggs because we're getting married later or we're getting pregnant later. So there's a lot of external hormones that are synthetic and unnatural being injected.
Mm-hmm.
The birth control, I think people are waking up to birth control, but all that really impacts your mouth.
Yeah.
And to bring it just in a nutshell, full circle, if your mouth isn't well and isn't healed and isn't feeling healthy, it's going to impact everything in your life, not only physically, but emotionally as well. And I felt it that night when I like went on Facebook and I wrote that out. And that's what got me into the world of women's dental health and actually creating that world because no one's talking about it. But our mouth is part of our throat chakra, our lips, our tongue, our mucosa, our teeth, and your ability to speak and express. Part of that, I wholeheartedly believe, is the health of your mouth. And that's why I take it really, really seriously for all the ladies I see. And that's why I do what I do online. But yeah.
Okay, so I first want to start off by asking, because, women's dentistry is a big blue ocean. And there aren't a lot of people out there with a shingle saying this is women's dentistry. So how did you learn? How did you figure all of this out? I mean, you're charting a new path.
I am. And it was that first pregnancy. And that's why I said that story with me, like going to Saudi, working there, getting a few like red flags and like how what I was seeing, like on, and I never learned about any of this in my books at UCLA. They never spoke about estrogen and progesterone. They never spoke about relaxin that you need during childbirth that can loosen your teeth. They never spoke about microbiome. And, they spoke about the general things that I'm sure you learned in medical school to become a medical doctor, and me too. So when I came back and I had that really hard pregnancy, I was like, God is putting this in my path because he's sharing to me what my mission is. Like, I discovered my mission and my passion. And I always say, like, I'm just getting started because there's so much work to do in this field. And I would like to go back one day to like Saudi or Aramco and to tell them what I learned since I've left there, because it'll help so many. But it's not just women there; it's women everywhere.
Yeah.
Like
You can do that after you develop a course
yes,
and teach other people,
yes,
because you must do that.
yes,
Um,
yeah.
why do you think, let's just like start at the beginning. Why do you think most dentists are still in that archaic world of drill and fill and no connection between oral health and systemic health, despite the fact that there have been studies? I mean, I remember studies in my residency, which was a long time ago, and I'm not going to share when that was. But I remember studies in my residency talking about that there is a direct link between periodontal disease and heart disease. So, we've been making this connection for a good long time. Again, not going to share with you how long ago that was. If you really want to know, you can look it up. Um,
Well, you look amazing, regardless. Goals.
you're
Hashtag goals.
you're very kind. So why is it still this way? I mean, when the dentists that are in training now are still getting trained drill, fill, fluoride.
Jenn, in my heart, I'd like to believe that everybody is doing the best they can with the conscious that they have, right? And when I was in Saudi, I started, we need to be listening, and we need to start feeling more as practitioners. Unfortunately, when I was in dental school, you kind of get numb to just, you need the requirements, you need to pass your tests, you need to pass your board, and you need to finish those requirements, which were like 10 root canals and 5 dentures and 7 partials and 5 gold fillings and 5 gold crown, not fillings, 5 gold crowns, and
Yeah.
and you're so focused on that, right? And you want to pass, and you want to become the doctor, and you want to, and there's been just so when I left and I had, I don't know, like almost $500,000 in debt, there's a huge egotistical component that, like, oh crap, I just spent all this money and I need to re-educate myself. Because I had to re-educate myself fundamentally. I did. So when after that happened, a year later, my daughter got vaccine injured. So I was one of those people. I was very trusting of I haven't really spoken much openly about this, but I'm like just flowing right now. God is flowing.
He is.
And
Yeah.
she got injured when she was 1, MMR and varicella. 27 days later, we were in the ICU. I had no idea why. I was doing what my doctor told me. Like, I trust you. If you're my doctor, I want to trust you. I'm not here to do your job, Dr. Jenn. I don't want anybody to do my job. Let's all do, our own
Yeah.
job and help
Yeah.
each other. And as I was walking through through the ICU ward, I saw a lot of really sick kids, like really sick kids. I'm like, God, I'm very lucky that my daughter's good. They were pumping her little body because it was like she almost suffocated on mucus that was like slime. So that's when I woke up. That's when I'm like, oh my God, I'm never going back to the way that I was practicing. Like, because we were taking insurances and we were playing the insurance game, and I was very unhappy. I was like, I want to close the office. I didn't care. Like, my brother and I were like this ready to be like, he's like, I'd rather be an Uber driver. And I'm like, I'd rather be a barista at a coffee shop because I love making coffee and tea for people. I
Mm.
love making drinks for people. So I'm like, I probably make more money there. I got a check for $4.84 for something right now that I would charge $900 for, and well worth it. So we were just very unhappy. So you're asking, like, why aren't dentists waking up? When you're a hamster on a wheel and you're so in that wheel, unless you have, I feel, a big traumatic experience like I did, it's very hard to nudge you. Like, have you ever spoken to a friend to try to get them to, like, I don't know, stop fluoride? Like, it took my husband a few years to stop Listerine. Like, it was on order. Like, it was on repeat. We'll talk about mouthwash later and how horrible it is for you, especially things like Listerine and Scope. So I think I'm very optimistic and hopeful because on Instagram, I'm getting like these hygiene students and I'm getting dental students that want to come and shadow and want to come visit the office and are very intrigued with the way that we're practicing in the office. So with podcasts like yours and all the other health podcasts that are starting to have more dentists on, more biological, integrative, holistic, whatever they want to be called. But that's how we're going to start spreading the world, because now you're going to take this information to your practice and you're going to tell your girlfriend about it like tomorrow night.
Mm-hmm.
You're going to share it. And I
Mm-hmm.
believe in that beautiful ripple effect. And that's what I want to focus on. I got a lot of crap from dentists when I first, so we do this root canal prevention procedure in the office. And we're able to save over 75% of teeth from needing root canals. And the other 20,
That is
it's,
amazing.
it's incredible. But
Amazing.
I
But
got
not
so much crap.
surviving because not surprising because you're dealing with the root cause of the problem rather
Exactly.
than the band-aid, rather than addressing the symptom, right? Because when you do a root canal, you're just taking the patient's perception away. That's all you're doing.
Exactly. Exactly. So with regards to the root canal, there's a time and place. Like, if you're in severe pain, if you have a necrotic tooth, your body already root canaled itself. And that's a huge source of infection for the body. So you need to take care of that necrotic tooth. And a lot of people message me. They're like, oh, we have a tooth that's a little more gray. So if you have a tooth that's more gray or a little brownish, that's a different color than the rest of your teeth, please have your dentist check if that tooth is alive or not. It's
Yeah,
very important.
it's probably not.
It's probably not alive. I'd say 90% of the time, it's not alive. And then you have to like make a decision. I'm all for full informed consent. I'm going to tell you the pros and cons of root canals. I'm going to tell you the pros and cons of keeping the tooth and extracting the tooth. And it's not one size fits all. Your medical history is different than mine. Your toxic load is different than mine.
Mm-hmm.
And we have to take into consideration all of that. So yeah, I can tell, like, I don't want to ramble, but like,
Yeah,
it's,
absolutely.
yeah.
Okay, so let's do some rapid fire questions because
Okay.
there's so much that I want to get through with you. I want to first know, you said you have 3 brothers that are dentists?
2 brothers. So all
2
3 of
brothers.
us are dentists.
Okay.
Yes.
Why? Why are all 3 of you dentists?
You
I
want to
need
hear
to.
the story?
Yes, I do. I'm fascinated by this.
So, we grew up in Saudi, and we're originally Lebanese. So my brother went to Lebanon for college right after he graduated high school, and his grades started dropping like badly. And my parents, being the wonderful, protective Middle Eastern
Yeah,
parents they
that
are,
doesn't fly though.
no, that does not fly. We're shipping us back to LA. So home base was LA, even though I'm a nomad. I don't know where home is. The world is my home. So we came back to LA, which I hated. I hated LA my first year here. So I was 16, Rashad was 20, and my younger brother was 12. There's 4 years between each one of us. And Rashad wanted to become an actor, my older brother. He's a very interesting, wonderful character. Maybe you'll meet him one day. But he wanted to become an actor, and my mom's like, over my dead body, like,
Mm-hmm.
you're not going to become an actor. Like, you can become an actor and do that film stuff, that like whatever, after you create and like have a set career. I just want to make sure that you're well taken care of, because I don't have a ton of riches to give you. You need to like take care of yourself. I get it. I'm a mother of 3 right now. I get it. I wouldn't do that if I were her, but I get it. I understand her.
No, but there's also, you want your children to develop their own sense of self and pride and self-worth. And, even if your parents were very, very wealthy, when we help our children, we don't help our children,
100%.
right?
No,
And
100%.
everyone has to blaze their own path.
Yeah. I just think that Rashad has a deep passion for film and production and
Mhm.
directing. Like,
So
he's
he
very
probably
talented.
would have been successful in that area anyway.
Anyways. But
Yeah.
the beautiful thing is he's doing that in dentistry. So he now teaches over 75,000 dentists worldwide how to do surgeries with his partner. And they do like online courses, and they film
Wow. So
courses,
he
and
has his own version of acting.
exactly,
He's a
So
star.
he tries to, he believes in the power of beautiful media, and he believes in there's a lot of beautiful stories to be told, and he just loves that artistic aspect of it. So obviously he
Amazing.
listened to my parents, so he's like, what can I do, path of least resistance, something that involves art, because he's an artist. Long story short, he went to Cal State Northridge. He was sitting next to a girl who was studying for her DAT, and she was like going over the DAT with him. And he saw there's a perceptual ability test there. So the part of the DAT, we have to like be able to take something that's 2D and imagine it 3D. Okay. He's like,
Mhm.
gosh, this is so interesting. And he was like, I want to take the DAT just because of like, he's like, and then there was a dental school up north that was 3 years, UOP, University of the Pacific, great dental school in
Mhm.
San Francisco. So he took the DAT. He did very good on the DAT, and he went to UOP, School of Dentistry, and he had a great time. He loved it. He loved working with teeth. He loved sculpting teeth and filling, and he really enjoyed that. At that time, I knew I wanted to be in healthcare. I knew I wanted to be talking to people. I didn't want to be behind a computer. I wanted to be in healthcare. Like, I loved health and fitness, and I was a swimmer, and so I volunteered in the ER, OBGYN, and when I was in college, there was a really cute dentist. I applied for a job there because my brother was in dental school. I'm like, let me see dentistry. And the cute dentist had his mom working on the front desk. So it was a very nice family practice. Within 2 weeks, I learned how to run the whole office, how to assist, how to do everything except billing, obviously. And I became his like all-star assistant. So I was working full time with him almost. And I was going to UC Davis. I was studying biochemistry at UC Davis.
Mhm.
And it was a great, I made great money at the time. And I was like, I had never like made money before, right? Like it was, and it just felt really good. And I really loved the ambiance. And I'd like tell my brother, oh, he did this today. And he's like, oh, what materials did he use? And then I'm like, gosh, I really like this. I really like the flexibility. I can teach, I can work with my family. I'm like, maybe I'll work with my brother one day. It was just, and I can help people. I can help heal people. Boom, I take my DAT, I score really, really well, and I started teaching for Kaplan, other dental and medical students, and then I got into like UCLA, UOP, and UCSF. Like I got into all my schools. But and yeah, and then I went to dental school, and then our little brother kind of followed along. Like he was like, okay, this is cool, and then he went to Florida. He ventured out to Florida, and it was great because I spent a lot of time in Florida.
That is an amazing story. It really is. And I'm sure, is your mother alive?
Yes, she is.
Is she extremely, extremely proud?
She doesn't express it as often as I would have expected,
Well,
but
that's
I'm sure
cultural.
deep down,
That's cultural. Yeah.
yes. Yeah. Yeah.
It's
Yeah.
more
Yeah.
expected
It's
than
like, of
not.
course.
Of
Duh.
course. Yeah. Yeah. I would expect nothing less, right?
Exactly.
Okay. All right. I got it. Okay. So, why is vitamin D important? I think that everyone understands that vitamin D is important for bones. I think that most people now understand that vitamin D is essential for your immune system, especially, we had this big thing happen to all of us in 2020, and there was lots of talk about if your vitamin D level before you got the thing was at a certain level, then the likelihood that you would be hospitalized or have serious complications was diminished. Whereas if you had low vitamin D levels, you had an increased risk of being hospitalized and being on a ventilator and yada, yada, yada. I think that most people in the breast cancer world, although I don't know if the medical oncologists have necessarily caught on yet, because I still see so many people who come to me and I'm like, what's your vitamin D level? And they don't know. And their medical oncologist isn't measuring, which blows my mind in this day and age. But in any event, most people, I think, understand the importance of vitamin D in immunity, in cancer, in bone health. What is the significance in oral health and in your and in your teeth?
Vitamin D is so important because vitamin D, and not only vitamin D is important in the dental world, vitamin K2 and vitamin D work synergistically to take everyone. So when growing up, my dad would be like, here, you need to milk for your teeth and your eyes and your bones, right? And you need calcium. He's right. You need the calcium. But people have been so focused on the calcium aspect of it. And little do they know that you need vitamin D3 and vitamin K2 to uptake the calcium and to bring it and to deposit it in the right place. Okay, so it's not just about the calcium. And magnesium is extremely important in that process as well.
Mm-hmm.
Okay,
Absolutely.
so the beautiful thing about vitamin D is that on X-rays you can see when somebody's deficient, even if they don't have so the chamber that houses your pulp. So our teeth, just take a step back. We have enamel, then we have dentin, and then we have our pulp chamber. And our pulp chamber houses our nerves, our lymphatic system, and blood supply.
Yes,
so each
that's
tooth
what makes the tooth alive.
Exactly.
Yeah.
Each tooth is an organ. Each tooth needs to be respected and taken care of and honored. That's how I feel about they're not just structured they're not just structures for chewing food. They're an extension of these nerves that come out. What's here? What's here? It's next to our brain. It's next to our spinal cord, our nervous system, close to our heart, and then the blood supply connects you to the rest of your body.
Mm-hmm. Yeah.
They're so connected. So when you do so at the beginning, when I first started doing this and started kind of slowly talking about it on Instagram, I was very, very vigilant at the beginning. And even now, I didn't want pushback from other dentists, especially older dentists that are going to come and be like, you don't know what the hell you're talking about. And so I didn't talk as much.
And they come at you.
They come at you. But now, I've replaced that anger and annoyance with just grace, and it is going to catch on, because you know what's starting to happen. I had a dentist bring me his mom.
Oh, that was good.
And he was a root canal specialist. He was an endodontist. And I was like, I'm happily going to take care of your mom, just like I take care of everybody else.
Mm-hmm.
But I could tell he was, at the beginning, a few years ago. So, vitamin D is so important, and it's low-hanging fruit. When people got rickets back in the day, and scurvy, it was vitamin D and vitamin C. What do we have in our mouth? We have mucosa. We really need we need vitamin C, we need collagen, we need vitamin D, the magnesium, the boron, the K2. They're finding that people who are suffering from cardiovascular issues and getting heart disease, they're very low in K2, and the amount of calcium that builds up in your in the vessels increases, because you need the K2 to take the calcium out of the vessel.
K2 deficiency.
Exactly. And into your bones and into your teeth. So your teeth, the status of your teeth is very reflective of how your bones are. We don't see our bones, but we can see our teeth. So your teeth tell so much. So that's why vitamin D3 is very important.
Yeah.
And before surgeries, we test our patients to make sure their vitamin D3s are levels the levels are good enough, because if you're extracting an infected root canal, We need good D3 for your immune system, for your healing, and if we're replacing a zirconia white implant, we need to make sure that you have enough D3 for that implant to properly integrate and for the osteoblasts and osteoclasts to work properly. And you need all those micronutrients to be working synergistically to make that happen.
Yeah. I want to ask you about something that we haven't talked about on my podcast yet. There's a saying called long in the tooth, and essentially what we mean, we're referring to people who are old. It's like a nice way. But it means that like the root of their tooth is basically like being exposed. It's gum disease and gum recession, right?
Yeah.
I see so many people
and bone loss
have and bone loss have scary gum recession and bone loss. What is going on there?
Okay. That is so multifactorial. And one of the reasons why hormones is important is because so let's a menopausal woman, postmenopausal woman.
Mm-hmm.
I see that a lot in postmenopausal women.
These are my ladies.
Those are your ladies. Okay. So that estrogen drop. So you need estrogen for your mucosal health. So I did this live with, I don't know if you know Angie.
Like Green. Your gums.
Yes.
Right. Yeah.
Yes. Your mucosa, like everywhere here is your mucosa.
Yeah.
Your gums are on. Yeah. So when you get that drop in estrogen, it impacts the way your osteoblasts and osteoclasts, the balance between. So the osteoclasts
so
are
like the building of the bone, the remodeling of the bone, the building of the bone, the remodeling of the bone.
Exactly. So we're in constant remineralization and demineralization in our teeth and our bone, right?
Yes.
And
which
so
is why DEXA scans are useless, because they don't speak to where you are in the process. So sometimes people come to me and they're like, yes, my DEXA scan improved. And I'm like, maybe. And maybe you're just in a building phase, whereas the last time you got measured, you were in a resorption and repair phase. So,
yeah. What is a scan that's accurate in your world?
Oh, I actually don't use bone density scans.
Oh, wow. Okay.
I don't think there's
okay.
Yeah,
all right.
It's another topic.
Yeah,
but I never have people expose themselves to unnecessary radiation, certainly not for the purposes of screening ever. If we have someone who has like pathologic fractures and we can't make sense of it otherwise, then yes, we're doing investigation. But I am not randomly having everyone do DEXA scans. But also, it is my practice to be very, very highly selective about who goes on aromatase inhibitors. I'm more on the everyone should get hormone replacement rather than people should be on these hormone blocking and deprivation treatments, because I see long term, I don't see short term. And I also understand about hormones in a way that nearly all medical oncologists do know.
Yeah. And that is so important. Like, that's what sets you apart. And that's what's setting our office apart, because back to your question, so you have that dip in estrogen, like your estrogen, progesterone, you're out. How's that impacting your mouth? It impacts your bone, it impacts your salivary glands, and it impacts your gums and mucosa in different ways.
Yeah.
And then it becomes a perfect storm. And then you start not only getting bone loss, so the jawbone, like we just said, it's in constant remineralization, demineralization. The drop in estrogen increases the demineralization around it. Okay. That drop in estrogen.
Just like it's doing in your bones, right?
Exactly. Yeah. Exactly. So that drop in estrogen is increasing the acidity in your mouth. So it's offsetting the microbiome. You have more strep mutans, P. gingivalis. Those are all disease-causing, cavity-causing, gum infection causing bacteria. Okay. Mm-hmm. So you're more acidic. You're producing less saliva. Your bone turnover rate isn't quick enough. Even your enamel, older people have more yellower teeth. They have
Mm-hmm.
their enamel thins out. Our dentin is more yellow than our enamel. So, and then couple that in with a little bit of sleep apnea, mouth breathing, a little bit of mentally not feeling well about all the changes that are happening in your mouth, and most likely
Mm-hmm.
as well in your vagina, because when you
Mm-hmm.
have if you have dryness up here, you have dryness down there.
Yeah, for sure.
um for sure, like it's so connected. So vaginal and oral tissue is very similar. There's progesterone and estrogen receptors the same way. They histologically stem from very similar germ layers during like post-conception and during
Mm-hmm.
the
Yeah. Yeah.
so how can it not be connected? How can we not be talking about this? Like,
We're not.
how is this not a course in dental school? How is this not a course in medical school and nutrition school? And goes back to you saying, I am working on a course. I did a course for kids to reverse dental cavities for moms. That was my
Ooh,
first course.
that's so great.
Yes.
That's
Yeah.
totally necessary.
Very, very,
Yeah.
very necessary.
Yeah. I was the mom that got the stink eye from the dentist when the dentist was like, "Can we do fluoride treatments?" I'm like, "No,
You
you
don't need
can."
it. So fluoride treatments, well, don't even like look at the toxicity levels and the IQ issues, which that in itself is enough reason. It's a band-aid. Like you need to educate these mothers of what really causes cavities and how to strengthen your teeth from within. And that goes
Yeah.
back to your vitamin D question.
Yeah.
That
Yeah.
goes back to the micronutrients and what are we eating on a day-to-day levels. And yes, brushing and flossing is important, but it's only one of the 5 pillars of dental health. Only one.
Yeah.
There's 4 other pillars that are very important. That's what I teach in the course, and it's yeah, it's so important.
Yeah. Are you ready for a breast cancer screening revolution? Well, I'm thrilled to introduce to you a breast cancer screening tool that I have only recently learned about, but I have universally adopted. This is the ARIA test. This groundbreaking at-home breast cancer screening test is one that I believe will completely change the game. So imagine a screening test that's as simple as shedding a tear, because that's ARIA. It's a non-invasive, convenient, and perfect for all bodies and all breasts. Dense breasts, implants, no problem. ARIA makes it clear for everyone, even women as young as 30. ARIA is backed by over a decade of clinical trials, thousands of samples, and it's developed alongside top breast health experts. Here's how it works. You collect a tear sample at home, and then ARIA then analyzes it for protein biomarkers that can signal early breast cancer. And the best part, you get a consultation with a breast health specialist to review your results. Now, ARIA isn't replacing breast imaging. I am using it alongside QT. It's complementing it and giving you a fuller picture of your breast health. Knowledge is power, and ARIA is putting that power back in your hands. It's time to take control of your breast health, and ARIA is another way of doing it. Go to aria.care, AURIA.care, and use my code DrJenn20 in capitals, DRJENN 20 to get 20% off. Back to our show. Hello, my beautiful listeners. I'm taking a quick break here to share something truly transformative with you today. If you're ready to take control of your breast health journey, then you need to get your hands on a copy of my book, The Smart Woman's Guide to Breast Cancer. I wrote this book to make a massive impact in the world of breast cancer, empowering women everywhere to make informed choices and educated decisions. You have so much more power and control over your health than you might think. And this book, this is a roadmap to harnessing that power. Inside, you'll uncover the truth about conventional treatments. They're often overestimated benefits and underestimated, underexplained, and underdisclosed long-term side effects. But more importantly, you'll discover the true drivers of health and how the choices you make at home every day can lead you to the best health, the breast health of your life. even after a breast cancer diagnosis. Whether you're looking to prevent a diagnosis, avoid recurrence, or simply live your healthiest life, this book is for you. Join me on this journey to empowerment and health. Grab your copy of The Smart Woman's Guide to Breast Cancer today, and let's revolutionize the way that we approach breast health together. Okay, so let's talk about dentistry through the ages and stages of life. So, the first question, I did have a couple of listener questions, and they want to know about dental x rays. Are they necessary? Are they safe? And how often should they be happening in children and in adults?
Okay. I'm team for the x-rays. It depends. It depends what I see clinically, kind of like what you just said. If there's a reason for you to take an x-ray, let's take it. If there's no reason, so with children, I can prolong the need for them getting an x-ray for a pretty long time. Very long time. Like, unfortunately, many offices say, okay, we got to take an x-ray because that's what insurance covers. And they'll get paid for that appointment. So x-rays and sealants and fluoride. Boom, boom, boom. That's a good $200 for appointment. You see like 40 kids a day. It's what is it called? It's strip mall dentistry. So that's like, but there is a time and place for x-ray. So someone who has a history of dental decay, if I want to see bone loss, I need x-rays to see the levels of the bones between the teeth.
Yeah.
If you've had dental work, to see the integrity of the dental work. When I'm cementing my dental work, I take x-rays to make sure my work is integrous. Integrous, is that even a word? It's properly sealed. Because if you have something in your mouth that's not properly sealed, that's a pit hole for all the bacteria to go, and then it leaks into your tooth. And so I don't have like a formula, a recipe of how often I need to take x-rays. Most of the adults that I'm
you
seeing,
shouldn't. Right? It should be based on need.
Need. Exactly.
Yes.
So if you've had, like, if you're an adult who's had like Invisalign 3 or 4 times, I need a full set of x-rays. I want to see the roots of all your teeth, because people who have had braces or Invisalign multiple times, their roots sometimes are blunted. They literally get shorter over time. If you want a full mouth rehab, I need a full mouth set of x-rays. So on adults, it's important for a baseline, but as they've been in my office, I go up to like 2.5, sometimes 3 years not taking any x-rays on, like, if you come in, I have a baseline a full mouth set of x-rays, which is the equivalent to the amount of radiation from a flight from California to New York. And there's ways to detox, and I give them my detox protocol and the foods to eat, and they do it and they're fine. But then they come in every 2 to 3 months for their hygiene visits, and they don't need x-rays because we're able to maintain. We're able to develop that rapport where every time they come, we're able to show them where they can do a better job brushing, where they're doing a great job. We discuss supplementation, medical history. And unless we feel the need, we don't take another set of x-rays.
Yeah. Okay. That's good. And then there are issues that affect each stage of a woman's life. So puberty, pregnancy, postpartum, if you're going for IVF, perimenopause, menopause. Can you talk to some of that and what you should be thinking about at each phase and each stage?
Yes. So I call each one of those phases transitions. We have transitions. And the first big one is puberty, right? And I think I think health isn't a primary focus during puberty. It's like more like the social life and how we're feeling emotionally, which is very important to health. But there needs to be like where you are on the growth chart and how cool you are and and those are all great. But our girls deserve better. They deserve better than, like, if they're having irregular periods, to be put on birth control, because that's going to impact their gums and So that's the first estrogen, progesterone. I call it, it's a huge rise. A lot of times they are in braces or Invisalign. They're mostly concerned about cosmetics. And don't get me wrong, I love cosmetics. I think health and beauty need to meet, and we
Hmm.
shouldn't only focus on one or the other, because there is a vanity component. And when I have a beautiful smile, I'm going to feel better about myself and I show up different
Absolutely.
in the world. So I'm not taking that away. I believe in cosmetic dentistry, but I call it responsible cosmetic dentistry.
Okay.
Okay. So she has her braces on, and if have you been to, so when I first moved to America and I went to high school here in Granada Hills, I was shocked at what I saw in the vending machines. I had never like eaten Cheetos at school.
Oh no, it's horrific.
It's so that was like, I feel like that's like when the seeds started flying. I'm like, why are they feeding us this? Like, and then the Smuckers, the jelly, the peanut butter jelly, and the chocolate
Oh
milk and the
no, it's
apple
like
juice.
a bunch of food-like substances and different versions of concentrated sugar. It's awful,
It's
awful,
awful,
awful.
awful. So
And,
yeah.
what's really interesting is this is something that it's like a rite of passage for teenagers to get the wisdom teeth out.
Oh God, yeah.
And yet we're taking wisdom teeth out of teenagers for the most part, or young 20s during a time when they are taking terrible care of themselves. Their diets are terrible. They're not sleeping enough. There's some of them are, just finished growing and so depleted. And then we take their wisdom teeth out and expect them to heal.
But why are we even taking the wisdom teeth out?
But that's a great question.
Why are our mouths getting smaller? Why is there no room for our wisdom teeth? What
Yes.
kind of food are we eating?
Yes.
So
Soft.
soft food. Women are, and I couldn't breastfeed my first two daughters properly like I wanted to. I'm in the medical world and I didn't know how important it is. And I didn't have the right support system around me. And just to go back to your question, like why women's dental health, women need so much help and support and love and
I know.
compassion.
I
And
know.
we need to help each other. That's the
I
bottom
know.
line. So when I made that decision, I told Rashad, I'm like, hey, you're going to see all the husbands and the partners and you're going to see the guys. I don't care to see guys. Like, I want to see the women. I really do. I connect, and guys are great. Don't get me wrong. They're fun to work on and they're fun to visit. They're the biggest wusses sometimes in the world. So
Oh my God. My husband has to get general anesthesia to have his teeth cleaned. It's
yeah, yeah.
so unbelievable.
It's crazy.
And I just want to give a shout out to my dear friend Sonia Gilch, because we were pregnant together and she was head of breast imaging and I was head of breast surgery. And I was on my first, she was on her fifth, but we pumped together every single day so that we were each other's support. I mean, she would have done it without me because she breastfed all five of her children for 2 to 3 years.
Bless.
Yeah,
Oh my
she
God.
she is
Incredible.
superwoman, truly
Wow.
super. And she's like
Wow.
4'11" and superwoman. I mean, she
Wow.
is unbelievable, unbelievable.
Wow.
Um, but she was the reason that I breastfed for as long as I did, because I, 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 I did it as much to keep up with her as I did to nourish my child, because I was like, if this woman who works full time and runs the department and has 5 children and I just have one, if she can do this, I can do this.
I can do it too. Yeah. No, that's how we support each other and inspire each other. And she influenced you in the best of ways. And that's
Yeah.
what I want to do. I want
Yeah.
you to influence me in the best of ways and vice versa. So back to puberty, and back to, so I feed my baby like hard foods. Of course, I'm watching him. I'm making sure he's safe. Please don't be negligent. Don't be irresponsible.
Yeah.
But I don't puree anything. I don't puree anything. I practice baby led weaning and I nurse him. Those are the, and that's the first. So nursing is the first orthodontic treatment of a child. And if he or she are properly growing properly in the sense that they're nasal breathing, their mouth is securely shut, their bones and their teeth are getting properly stimulated with harder foods, because when you're using, when
Also, you develop all of the muscles of your
ex-
mouth, and
ex-
bone follows muscle, right? So as you do that, as you develop that skill, so too will your bone grow in.
exactly, exactly. And as your bone grows in properly, there should be enough room for our wisdom teeth.
Yeah. Yeah.
So yeah, the wisdom teeth thing is, it's like just it's a cash cow for some offices. If you know how
I
much money
know.
some of these offices are making, it's like it's a lot of money. It's like great
I
money.
know.
But it's like
I
you can
know.
make money, I don't know, doing the right thing. And I just
Yeah.
think that extracting wisdom teeth, and they're just extracting, suturing, and goodbye. Like, so there's something I called cavitations that form in areas where there's wisdom teeth when the bone is necrotic in the area where the wisdom tooth is has been removed. And back to what you were beautifully saying, like, what are they eating at this time? What is their nutrition level? Are they taking good care? Are they cleaning their mouths properly? So puberty is a beautiful opportunity that we're missing.
Yeah.
It's a beautiful opportunity that we're missing because we're focusing on the wrong things. And I think the orthodontists need to get on board, because they're more likely to see an orthodontist than they are to see me
Mm-hmm.
right now, unless they have tonsil stones or bad breath and they start freaking out about that. You don't want to be going through puberty and have bad breath. But it's so connected. So I need an orthodontist. I think nutritionists at school should be talking about this. I think I don't think only a cavity check should be done. So before they go to school, they need to go to a dentist so that they can
Yeah.
properly like check them off.
Yep.
A lot of dentists just like sign it, like it should be taken seriously.
Yeah.
For a woman who is entering puberty, I think there needs to be like an hour, dedicate an hour in her life during
Yeah.
like during that time to educate her about this and why it's important,
Yeah.
and show her the end result if she doesn't take care of it. That's how you can scare them in a good way.
So we are in a time like no other, and be it women are starting later, even men are starting later. There is a fertility problem in this country. It was certainly made worse by the thing that happened and was given to a lot of people in 2021. But it's not that simple. It's not only that. We are surrounded by things that disrupt our endocrine systems, that disrupt our hormonal systems. So microplastics and all the things that we call xenoestrogens or refer to as xenoestrogens, nonstick, fragrance, antibiotics. All of these things have a terrible, terrible impact on fertility. And there is also the issue of how your oral health plays into that time of your life. So if you're in that phase, and lots of people have gone to the IVF and egg freezing place because they're not ready for children in their 20s, or their relationship hasn't happened yet, or for whatever the reason, they are choosing to go that route. So what do they need to know about their oral health during this stage of their lives?
Oral health is not only really important for yourself, but also for your future child. So what you do is very important for him or her. So that's where I always start by that, because we're driven by our children, and you
Mm-hmm.
care for your child more than you care for yourself most of the time.
Yeah.
And that's just human nature as a mom. But let's talk about the men. I know I've been focusing on the women, but let's talk about the men. Periodontal disease in men has been shown to increase apoptosis of sperm, so lower sperm count, and also decrease sperm motility. So if someone who's struggling to get pregnant, I feel like the lowest hanging fruit is to get all sources of infection in your body under control. You don't want chronic infection in your body. And your mouth is one of the number one hidden sources of infection.
Yeah. Yeah.
So getting that deep cleaning if he needs, getting the oral microbiome tested to see if there's any high levels of pathogenic bacteria. Research is showing it takes almost 6 months longer to conceive when there's periodontal disease in either the man or the woman. That's low hanging fruit. Like, go visit your dentist, get your deep
Yeah.
cleaning, take care of your mouth, and see what happens. I'm not saying that's a direct causality. Nothing is like cancer doesn't form overnight. It's a bunch
Right.
of insults to the
Right.
body. Same
For
thing with
sure.
fertility.
Yeah.
You know, if you're injecting yourself with tons of hormones, I have someone, she openly shared her story, so I can share her name, Jessie Golden. She's 45. She got pregnant. She has rheumatoid arthritis. It was undiagnosed for many, many, many years. Her body was rejecting the fetus. Long story short, I just watched her full YouTube video. I think she's gone through 3 rounds of IVF and 2 miscarriages. And her mouth is the xerostomia, which is dry mouth, the discomfort in your mouth after injecting all those hormones. So I tell people after each round of IVF, visit your dentist, get a good cleaning. We use ozone, and ozone is wonderful. We're able to avoid so much antibiotics. Antibiotics is wonderful when it's needed. It's just overprescribed. Like, I had strep throat. I needed antibiotics. It was too advanced. I was trying all the natural stuff. It saved me. But not every person who has pathogenic bacteria in their mouth needs antibiotic, or who gets surgery needs antibiotics. So it's definitely overprescribed. And the more we prescribe them as dentists, it's going to offset your oral microbiome as well. So with regards to the fertility world, I would
It's
say
going to affect all of your microbiome, not
all of
just
your
your oral microbiome.
Oh,
Yeah.
I mean, 65% of your gut health comes from your mouth.
Mhm.
If you bleed when you floss, you have leaky gums. If you have leaky gums, you have leaky gut. It's so connected.
Yeah.
So this is such an important part of your body. To me, it sets the tone. To me, your eyes and your mouth set the tone.
Mhm.
Set the tone. Like, one is your portal to your soul, and one's a portal to your body. I don't know. Like, and they're both very important. So, so if you're undergoing fertility treatment, I had a woman go through 20 rounds of IVF. She was a wreck. She finally got pregnant. She got her baby girl. She's as happy as can be. But also, when you're feeling emotionally off and feeling that's financially stressful. It's stressful to the relationship.
Yeah.
What are you gonna take great care of yourself unless you're super duper proactive? What kind of foods are you gonna eat? Comfort foods.
Yeah.
So
Yeah, you're so right.
it all adds on to one another.
Mhm.
And you're
Yes.
going to be so tired. You're probably going to sleep without brushing and flossing many nights with injecting all those hormones. So
Mhm.
if you I slept many nights without brushing and flossing during I had a very hard pregnancy. Thank God I was eating like the Weston Price diet. I was taking care. I was trying to supplement as much as possible.
Mhm.
So we're not seeking perfection here. We're seeking awareness to understand that your oral cavity and your hormonal fluctuations throughout your lifetime is going to impact your oral cavity.
Yeah.
So let's just take more care of it as it ebbs and flows.
Yeah. Now, we did talk about the changes that come with perimenopause and menopause, and that being related to estrogen deficiency. It has a significant and profound effect on the health of your mouth, on the mucosa, on the teeth. And, what I advocate for, and this is why I advocate for it, it's because if you lose that estrogen, even though I understand menopause is a natural state, sometimes people are put into it very unnaturally, like if you're being treated for breast cancer. But, I understand that people say that menopause is a natural state. But also, we that was from a time when we didn't have the solutions that we have today. And most women died in their 50s or before. So they never had to live 50 years in this postmenopausal state. And the truth is that when the estrogen goes away, everything starts to die and you lose a lot of form and function, and it's not necessary. And I include the breast cancer population in that category. It's not necessary to lose your form and function. And estrogen is never the problem. It's never the cause. And we have to consider that women who have had breast cancer deserve that same attention and option and consideration that women who don't have breast cancer have. So I'm very, very, very much in favor of bioidentical hormone replacement, even in the hormone positive breast cancer population.
And we're finding there isn't a lot of research done on this yet, unfortunately. I hope that more is. But for my postmenopausal ladies that are undergoing bioidentical hormonal replacement therapy, their symptoms are improving. The dry mouth improves. The burning mouth syndrome with proper supplementation improves.
Yeah. This does not surprise me.
It's not,
because your soft tissues improve, right?
exactly.
You go from having dry everything to getting the moisture back and getting the thickness back and getting the texture back, and
Exactly.
it all tracks because that's what estrogen does.
Does.
So, and I'm
I
not advocating for estrogen alone. I tell people that, we replace estrogen and progesterone and testosterone and DHEA, and, we replace what you need.
Yeah.
But the goal is not to restore, the levels that you have in fertility. It's not to restore menstruation. It's not to restore ovulation. It's not for any of those purposes.
Just get comfortable and have a good quality of life.
Yes, it is the minimum amount you need to keep your brain working and keep your heart working and keep your bones working and your joints working and your vagina working and your relationship working and your mood working. And, that's what it's there for.
100%.
That's what it's there for. It is there in the esteemed words of Dr. David Rosensweet. It's to keep women out of nursing homes, wheelchairs, and adult diapers, and the dentist's office.
Yes.
Right?
Well, electively, exactly.
You want to go there electively, not emergently.
Or preventively, like just come in for your cleanings. Let's get a high five and have a nice discussion. And
we all love high fives.
Instead of dealing with like 10 cavities at the gum line because of the xerostomia. Yeah,
absolutely.
Do you work with women so I have a few patients that are actually they are looking for practitioners that really understand hormones, and I have full confidence in you. I'm going to ask you off who do you recommend, but if because
I have a long list of people who see the world the same way that I do. Some of them are out like I am. Some of them are doing it on the DL. And either way, I'm happy to be a resource for you, because while I use my very loud voice to impact change, there are people who are doing it but don't want to be out there about doing it. Yeah. So, I hope that I can take the shame away from it, and that we can make it perfectly clear that it is perfectly safe. And the truth is that women who have had breast cancer, they get recurrences whether they take hormone replacement or not. But when we compare the population of women who have had breast cancer and are taking hormone replacement to the population of women who are not, the women who take hormone replacement do not have more recurrences. They have better quality of life, and they have the same or better survival, because if you're happier and healthier, the likelihood is you're not going to have a recurrence. Now, that doesn't mean it's not going to happen. Of course it's going to happen. But all we have to do is look at the world since 2003 to know that taking away hormone replacement didn't stop breast cancer. In fact, the breast cancer incidence went up. And it didn't stop recurrences, because no one was doing hormone replacement after breast cancer. And we still have the same exact number of deaths every single year from breast cancer, the same exact number. So it's not the hormones. It's not the hormones, honey. It's
Yeah.
not.
Yeah.
And we need to take a long, hard look at why all of that information and why all of that narrative was out there. And it's pretty easy to see. Why would you advocate for a 1 or 2 drug system when in fact you can instead put them on 6, 7, 8, or 9 drugs? So why put them on hormone replacement when you can put them on anti-anxiety pills and antidepressants and sleep medicines and beta blockers for heart rate and anxiety, and you can put them on medicine for their joints and NSAIDs and pain relievers, and you can put them on medicines for their bones, and you can put them on a medicine to stop their bladder from leaking sometimes. And, and on and on and on it goes, right? And so this polypharmacy that is supposedly the solution, as opposed to just having women on hormone replacement, I mean, it's really despicable. It's really dubious and despicable. So the time for change is here. It's now. And I have a posse of people who are going to make sure that this isn't going to happen anymore.
I love that. Thank you. Thank you on
Here.
behalf of all women.
Absolutely.
Like, we want to
Okay,
function. We want to be happy.
So I want to talk specifically about drugs now that we got onto that topic. So how do birth control pills, which women are put on as like a trigger reflex, have cycle irregularities, put them on birth control pills, have acne, put them on birth control pills, have headaches, put them on birth control pills. I mean, this is happening all day, every day in the gynecologist's office. And no one's asking what are the long-term consequences, of which there are many.
So many.
Right?
So many.
But specifically, can you address what's happening in the mouth?
So these are synthetic hormones.
Yes.
And
but to be clear, everything is synthetic, but these are non-bioidentical in that these are hormones that are non-physiologic. We don't know of many of these forms of hormones. They're very good for pregnant horses, but they were not meant to be in humans.
We are finding so much gum inflammation. And so by the time somebody comes to my office, they've done a lot of research, they've vetted me out, and they've gone to a lot of other doctors. We're usually the 3rd or 4th or 5th opinion. And it's usually after, like, for example, oh crap, I need to get off birth control. This is making me feel ill. It's making me feel sick. It's making me feel crazy. I'm unable to take proper care of myself. So we're seeing a lot of gum issues. And depending on how long the woman was on the birth control, is how I evaluate the severity of the gum issues. The longer I'm seeing more bone loss in women who've been on birth control longer. If you're on birth control for a couple of years and you come to me 20 years later, I don't think it's had massive irreversible effects. If you've detoxed and you've cleansed and you've visited your dentist, hopefully. But what I want to say is for anybody on birth control is to really pay attention to the quality of your gums and the quality of your saliva as it changes as you're on that birth control. I was sharing, I did a live with Angie Green called Open Mouth, Open Vagina. There's a lot of similarities between vaginal tissues and our mouth, physiologically, histologically, and anything we do to restore one area is going to impact the other because they're also connected with fascia. That's another topic, but they're very connected.
We did a whole podcast on it. So
I love that.
My people know.
Okay. I love it. So it's so important to, it impacts your mucosa, and it just causes inflammation. And when you're inflamed, it's just not going to make you feel
Yeah.
well at all.
Yeah.
Yeah.
Um, what about other drugs like acid blockers?
Acid blockers. Um,
And if you don't know, and if it's not a thing, I'm just asking, and I was just thinking about
can
because
you give
we,
me a type of acid
yeah,
blocker?
like proton pump inhibitors or,
Oh, yes, yes,
yeah,
yes. No, they also like, and I think, is that one of statins,
no,
proton pump, like these drugs?
well,
They,
statins are another class of drugs that they're uh, HMG CoQ-A inhibitors, and they prevent the production of cholesterol, which has very, very, very detrimental effects on the rest of the body because what we've been taught to villainize cholesterol because,
yeah,
um, well, primarily for the sale of cholesterol blocking medications. But cholesterol is not the issue. It is a
yeah,
very, very, very important molecule. It is the base of all of our hormones, our
cells.
neurotransmitters. It makes up our cell walls. It's very, very important.
Yeah,
And depleting cholesterol never helped anyone.
no,
And in fact, it has lots and lots and lots of side effects and consequences like depression. Um, for men, it's loss of libido. There are mood changes. There's impotence. You know, not for nothing. Um, and so I unless you have familial hypercholesterolemia and your cholesterol is in the 300s and 400s, and then, that's a different story. You need to slow down that train. But for the most part, if your cholesterol is going up, specifically your LDL, that is your body, because cholesterol is a very anti inflammatory molecule. That's your body trying to put out a fire. That probably goes along with birth control pills because they're so inflammatory that they probably do make people's LDL rise.
yeah. I'm not familiar with that, but and the acid, uh, what was the one you
The
asked me?
acid blockers, the
The
proton
acid
pump
blockers.
inhibitors.
I'm not familiar with that, but with the anti-cholesterol medication, it impacts your, like, it's anytime the mouth is very inflamed and red, and your gums are bulbous and you bleed
Mm-hmm.
when you floss,
Mm-hmm.
you need to just take a step back and look into it. Like, what am
Mm-hmm.
I ingesting? What am
Yeah.
I taking? How am
Yeah.
I breathing? And I would take a look at every single one of the pharmaceutical medications being prescribed
Mm-hmm.
to my patients, and I
Yeah.
break it down with them. And a lot of these pharmaceutical medicines cause a lot of dry mouth, a lot of dry mouth. And then a slew of other things happens when
Yeah.
the dry mouth and
Yeah.
all the burning mouth syndrome, the changes on your tongue, um, uh, decay, the tonsil stones. So it's your immune system acting up
Yeah.
to be like, hey, you're ingesting something.
Yeah.
Uh,
What about antidepressants?
oh, those are so antidepressants and anti-anxiety depression medications. I had this one 11-year-old boy come in, I think right before I got pregnant. And I could tell there was something off in the home, and they have him on anti-anxiety medications, antidepressant, and ADHD medication. Okay.
Oh, goodness gracious.
So I did my full exam. I tested his nitric oxide, his pH, awful, off the charts. I looked at his mouth. He had severe crowding, open mouth posture, nutrition, awful. He wasn't eating well. This boy was not sleeping. He was not sleeping. He was not getting proper oxygenation to his brain.
Mm.
So he was a chronic mouth breather. He had severe inflamed gums in the front and really bad decay in the back. Horrible microbiome. And they have him on anti-anxiety medications and antidepressants. And they what is a big side effects of these two medications and the ADHD medications is dry mouth, is xerostomia. So we're adding insult to injury. This boy is not breathing properly, and at night, by the way, when you're sleeping, you don't produce more saliva. So that's why I'm a huge proponent and believer in mouth taping, because to lock in the saliva that we go to sleep with, that we can stay moist and protected. So antidepressants cause a lot of dry mouth.
Yeah.
And a lot of people on antidepressants, they come into my office on antidepressants, and we don't only talk about the mouth, we talk about everything else, like sauna use, exercise, Reiki, energetic, healing your emotions. We have a biocharger that we sit around and have like a heart-to-heart conversation. It's easy to drill on people's teeth. It's very easy. It's not easy to heal people. It takes energy and effort. So after we speak about all these things, their main thing is they want to get off their antidepressants, or at least decrease the dosages. Decreasing the dosage will help. I'm not telling people to, please, obviously consult with your doctor.
Of course, this is a podcast, everyone. This is not a personal medical or dental consultation. And any changes that you make, you should make in cooperation and conjunction with your provider. We are not your provider.
Yes, exactly. So, but as you start learning more and as you start talking to your provider, over the years, you start making changes. And over time, my patients are getting off their antidepressants and anti-anxiety. And I see a different mouth. The reason I love mouths is because it tells me a story. Every mouth tells me a story.
Literally. Yeah. Literally. Okay, so I wanna end with something that you brought up a little bit, and this is still like such a big cultural thing. What is bad breath? And why should we not be using Listerine or Scope? Why is that not the answer?
Listerine and Scope. So never use anything with alcohol in your mouth, because at the end of the day, what makes a healthy gut? What makes a healthy vagina? What makes a healthy mouth? It's the microbiome. If we mess with the microbiome, it's going to mess with the health of it. And it's all interconnected. So what Listerine, Scope, and Act, and all those mouthwashes that we see in our drugstores, they all mess with your microbiome. They're not. It's a Band-Aid. Like, my husband was addicted to Listerine, specifically Listerine with alcohol, and I spoke to him. He's like, it makes me feel like my mouth is clean. The power of marketing. They're putting billions of dollars in the marketing to
It is
make,
no joke.
Leedia feel like when she swishes with that Listerine, it's going to clean her mouth. Go in between, like, I remember the commercials. They go in between the teeth and they remove all the plaque. That's BS. That's BS. Not only is it horrible for your microbiome, but it's horrible for nitric oxide production, because it offsets your system. So stay away from all those mouthwashes. If you really need something to feel better about yourself, there's some cleaner mouthwashes. I say make your own at home. Salt water is wonderful. If you are a pregnant woman or going through a bout of stress or IVF or major hormonal changes, is going to offset the pH of your mouth, I would do baking soda mouthwashes, and those work really nice. But I always say this to patients: please work with your dentist, because even those mouthwashes, even the natural stuff, if all overused, can offset your microbiome. I think the focus should be your diet, your breathing, and your habits. What I mean by that: eat whole foods, know where your food is coming from, no processed foods, no processed carbohydrates. Don't feed your children goldfish and pretzels and crackers. Those are just as bad as Sour Patch Kids, especially the gold. All the sticky crackers are horrible. Pay such close attention to your breathing. if you're mouth breathing, you're missing an opportunity to heal your mouth, but also heal your brain and your mind, because you're not getting properly oxygenated. You're not making nitric oxide, which is responsible for vasodilation, and in men also has been linked to erectile dysfunction. But I
And
always say,
heart disease.
and heart disease, yes,
Mm-hmm.
high blood pressure issues. Um, I always say your nasal health is as important as your oral health. So next to my nightstand, I have my nasal spray. It's saline. I spend a couple minutes really cleaning my nose before I put my mouth tape on the nights that I put mouth tape on. If you cannot breathe through your nose and you breathe through your mouth, you're losing an opportunity to filter your air. You're drying out your mouth and you're messing up your microbiome.
Yeah.
So breathing is so important.
It is. It is. There's a great book by James Nestor called
Love it. Breathe.
Breathe or Breath.
I love it.
I never know how I'm supposed to pronounce
Yeah.
it, but it's
I think
yellow
it's breathe. It's
and
yellow, and I give
it's
it to
an
my patients.
amazing, amazing,
Oh my
amazing
God.
book that everyone should read. Um, this was an awesome conversation. I so loved having you.
Thank you.
Oh, one last thing. Flossing or water pick or both?
If you can floss, floss. Water pick is for those, like if you have a dexterity issues, if you have a wild teenager that won't floss, that doesn't know the value of it. Water picks are great, but if you can floss and get in between your teeth, and not only up and down, hug each tooth and
Mm-hmm.
clean each side of the tooth.
Yeah.
That's proper flossing.
Yeah.
Water picking, I feel like if you're in a hurry, if you can't get in there, but flossing is the gold standard.
Yeah. Got it. Okay. Where can people find you?
I'm mostly on Instagram these days. So at Dr. Leedia, and our website for booking appointments, but that's like my main channel. And I
And
have a
where are
new.
you located for those
We
of you who
are
want to book an appointment?
We are in Beverly Hills. I work with my older brother. I turned him on to biological dentistry, so he practices full-on biological dentistry like I. He does all the surgeries now, and we work beautifully together. It's a boutique dental clinic, and it's a dream of a practice coming true.
That is amazing. So I thank you so much for sharing this with us, with my community. The work that you're doing is so important. And we need people who are thinking about dentistry for women because we are not another version of a man. And this is demonstrated time and time and time again. And the medical industry has really ignored women and differences in women and the needs of women. And it's so important, the work that you do in bringing this to the forefront. So I thank you so much for that and for your time today and for your great conversation. I loved having you.
Thank you. You're wonderful to speak with. You're really easy to talk to. Thank you for having me.
If you enjoyed this episode, please share it with someone who needs to hear it. If you are on a breast cancer journey, please get a copy of my book, The Smart Woman's Guide to Breast Cancer, because this will allow you to make informed decisions and to really go to that place where you can truly heal. Remember the importance of biologic dentistry. So many people ignore that when they're on their breast cancer journey, and your oral health is a reflection of your overall health. So make sure you're taking care of that, and know that I will be back next week, same time, same place. It's Dr. Jenn. Bye for now.